Human metapneumovirus, HMPV, is a respiratory pathogen first identified in 2001 in the Netherlands. It is known to cause a range of respiratory illnesses, from mild cold-like symptoms to severe conditions such as bronchitis and pneumonia, particularly in young children, the elderly, and immunocompromised individuals. The virus typically circulates during the winter and early spring months. Recent developments in India. As of early January 2025, India has reported several cases of HMPV infections, primarily among infants. Bengaluru, Karnataka, 2 cases were confirmed, a 3-month-old girl, and an 8-month-old boy, both with a history of bronchopneumonia. These cases were identified during routine surveillance by the Indian Council of Medical Research, ICMR. Ahmedabad, Gujarat, a 2-month-old boy was diagnosed with HMPV after being hospitalized with respiratory symptoms. Chennai, Tamil Nadu, 2 young children tested positive for HMPV, and are currently undergoing treatment. Kolkata, West Bengal, a 6-month-old child was detected with HMPV and is now recovering. These cases have raised public concern, especially in light of reports from China, where a surge in HMPV infections has been observed, leading to overcrowded hospitals. However, Indian health authorities have emphasized there is no direct linkage between the cases in India and those in China. The Union Health Ministry has stated that the situation is being closely monitored and that there is no cause for alarm at this time. Government response and public advisory. In response to the reported cases, the Indian government has taken several measures: surveillance and monitoring. The Ministry of Health, along with agencies like ICMR and the National Centre for Disease Control, NCDC, is actively monitoring the situation. Adequate diagnostic facilities are available through ICMR VRDL laboratories to detect HMPV infections. Public communication. Health officials have advised the public not to panic. For instance, Maharashtra Chief Minister Devendra Fadnavis stated that the State Health Department would issue a comprehensive advisory and reassured citizens that HMPV is not a new virus. Preventive measures. The public is encouraged to follow standard respiratory infection prevention guidelines, such as maintaining good hygiene, avoiding close contact with symptomatic individuals, and seeking medical attention if respiratory symptoms develop. Comparison with China's situation. In late 2024, China experienced a significant increase in HMPV cases, particularly among children under 14, leading to concerns about a potential new pandemic. Social media images of crowded hospitals further fueled public anxiety. However, Chinese health officials have stated that the surge is consistent with typical winter respiratory infection patterns, and does not pose the same threat level as COVID-19. It's important to note that while HMPV can cause severe illness in vulnerable populations, it is generally a manageable virus with established preventive measures. The World Health Organization has not declared it a global health emergency. Conclusion. The current status of HMPV in India involves a limited number of reported cases, primarily among infants, with no evidence of widespread transmission. Health authorities are vigilant, and have the necessary infrastructure to monitor and manage the situation. The public is advised to stay informed through official channels and adhere to recommended health guidelines to prevent respiratory infections. Subscribe, like, share and comments for the latest news about HMPV.